everyone, good day. My name is Bailani Biusman, and for today I'm going to perform the Perineal Care external douche. Perineal care is a cleaning by way of washing the genitals and anal area by using a plain water or medicated solution. The purpose is to cleanse the perineal area of bodily secretions and excretions, to eradicate the unpleasant odor, to prevent skin irritation, to prevent infection, and lastly, to provide comfort to the client. First, check the client's chart to verify the doctor's order to ensure that you are doing the right procedure to the right client. Second, identify the client, establish rapport. To elicit the cooperation of the client, explanation reduces apprehension. Upon entering the client's room, you need to greet the client and be courteous. Then after that, don't forget to wash your hands to deter the spread of microorganisms. Explain the procedure to the client and screen the client to allay client's fear and anxiety, and also provide patient privacy and assurance. Good morning, Mrs. Cruz. My name is Bailani Biusman, your student nurse for today. So today, ma'am, I'm going to perform a perineal care, which means I'm going to wash your private area. Is that okay, ma'am? Because this area is prone of infection. Do you have any allergy by using betadine, ma'am? Okay, ma'am. If there's a door open, close it, and also a curtain to provide privacy. The materials needed, we have a bed pan, kidney basin, working forceps, pick up forceps, dry cotton, cotton with soap solution, sterile basin or sterile kidney basin, perineal pads, surgical gloves, and gauze pad. And we have here a pitcher with sterile water used for flushing of the perineal area. And we have a bath blanket and also the waterproof underpads. Gather all the materials needed and place at client bedside. Equipment on the bedside save time by avoiding unnecessary trips of the nurse during the procedure. Place the client in a dorsal recumbent position for the client to have a comfortable position and accessibility for the nurse during the procedure. Drape client, exposing only part to be cleansed using triangular draping method. Fold client's gown up above the genital using the top sheet. Fold linen into triangular shape so that the base of triangular is placed above the knee of the client. The pointed ends of the base are wrapped around the client's leg. Providing privacy can ensure a trusting relationship, thus resulting a cooperation from the client. So this is our bath blanket. Place it into the abdomen of the client. And always remember that you need to maintain the patient privacy, so expose only the needed area. Next, you need to wear a pair of gloves. You should know that the appropriate size of your gloves so that you can work well during the procedure. Place the bedpan under the patient buttocks. So this is the bedpan. We need to place it under the patient buttocks in order to protect our linen from soilage. So ma'am, can you please lift up your buttocks? I will insert the bedpan. Is that okay, ma'am? Wet the area by using a sterile warm water. And now, we need to flush the perineal area with a sterile warm water. But before flushing, we need to determine first the temperature of the water in order to avoid worms. So you can use your wrist, you flush it. Okay, so the water is the right temperature, so we will now flush the perineal area. Okay, before you perform or cleanse with a cotton ball, you need to place your waste receptacle below the bedpan. So this is our sterile kidney basin. We will open this on bearing in mind that we should not be contaminated, so we should not touch the inside surface. Using pick-up forceps, get 7 cotton balls soaked in soup sad solution. And put it into the sterile kidney basin. Get a 7 cotton balls. 1, 2, 3, then put also a dry cotton balls using a pick-up forceps and put it into a sterile kidney basin. So now that we have already prepared our cotton balls, we will now start with the external douche. In cleansing the perineal area, the first cotton balls should be in a zigzag motion. So in your mons pubis, upward towards to your lower abdomen, and then after that, from the mons pubis in zigzag motion upward to your abdomen. And after that, drop it into your waist receptacle. And the second cotton balls should be on the farther leg from the inner crease of the groin, zigzag motion, to your farther leg toward your knees. Then after that, drop your waist into the waist receptacle. The third cotton balls should do in opposite side. From your nearer crease groin, zigzag motion. The fourth cotton balls, we will now separate the labia using our thumb and our pointing finger. Start with the farther labia. In a downward stroke towards your groin. Then, drop your cotton to your waste receptacle. The pith cotton balls should be used on the nearer labia. Again, use one stroke downward motion. Then drop the cotton to your waste receptacle. Then the 6 cotton balls should be used to cleanse from your clitoris downward to your urinary meatus, to the vaginal opening, to the perineum. So from the clitoris downward to your perineum. Then put your waste to your kidney, to your waste receptacle. Then lastly, the 7 cotton balls is using to cleanse your clitoris downward to your anus in a downward motion. Then drop your waste to your waste receptacle. So now we are going to rinse the perineal area of the patient using the sterile water. Dries with operated sponge or gauze pad using the same technique. Start to the top to the bottom. Then after that, remove the bedpan. Excuse me, ma'am. I will now remove the bedpan. Then turn the patient into side and dry her buttocks or her lower back. And now put a diaper or sanitary pad. Dry the extremities of your patient and remove the bath blanket and make your patient comfortable. After that, remove your gloves, bring back the equipment to the utility room, and perform aftercare of all equipments that you have used to this procedure. And don't forget to wash your hands and document the entire procedure. That's all.